Greetings, everyone. Thank you for joining us today in our ongoing series of discussions on topics of importance to our campus community as we collectively face the challenges of COVID-19. In previous videos, we have discussed a range of topics from mental health to the campus's transition to online learning. Both of those videos are posted to the college's YouTube channel. Today, we'll discuss ways for people to stay physically healthy during these stressful times. I'm joined by two fantastic members of our Kinesiology, Sports Studies, and Physical Education faculty. Dr. Lenz is an associate professor whose main areas of research include the impact of physical activity and sedentary behavior on health, as well as the nutritional impact on exercise recovery. Dr. Christopher Williams is an associate professor who specializes in neuromuscular performance and power training. He's also the college's biomechanics lab director. Thank you both for joining me today.
Thank you for having us.
I wanted to start with you, Chris. Obviously, with gyms and fitness centers closing, people are having a harder time exercising. For those who are used to having somewhere else to go to work out, what tips do you have for people who are working out at home?
Well, the first tip, I think, is to be adaptable. You aren't going to be able to use all the equipment that you had normally used, and so you've got to find alternatives. And sometimes you have to be adaptable and creative. But one of the things that we actually focus on in my lab is a lot of body weight based exercises. And of course, at home, those are ideal for working out with a number of variations. But body weight exercises are great. Simple body squats, a lot of one leg variations, going straight up and down on a single leg, going forwards, backwards, side to side on a single leg. If you needed support, you can do these in a door frame where you can hold on to either side and support yourself. Even using a chair to indicate how low you go. We would call that a box squat in the gym. You can do the same kind of thing. We're all probably surrounded by our kids, at least those of us who have them. And with my kids, twice a day at the minimum, we have them do what we call 30, 20, 10, 5s. And so they'll do 30 sit-ups, 20 jumping jacks, 10 push-ups, and 5 burpees, all in a row. We also do around the house races, so they run around the house and so you can get the best times and things like that. So those are all different variations that we do here at my house, and that anybody can do really.
One of the fun facts about Chris is that he takes a trip to California every year with all 4 of those children. They may be different this summer, but there's certainly an opportunity to get used to being close together for a long period of time.
Sure.
Adaptability is clearly the key to making any exercise regime work. Liz, if people are exercising a little less or differently, are there dietary or nutritional considerations they should be thinking about?
Absolutely, and I'm not a registered dietitian, so I'm going to talk more broadly and generally about this topic. And from the exercise physiologist perspective, I like to think about energy expenditure in the forms of movement, metabolism, keeping our body working, and the balance that we need to create with our food choices during the day. And since we may be less active or more active depending, we have to find that balance. So I've thought of a couple ways to help us think about our food choices throughout the day. I think the easiest thing for people to do is just reduce their portion sizes in general. You know, they don't have to change their full diet, but maybe they're reducing the total calories that they're actually consuming throughout the day. What we've tried to do in our house is to make better food choices. Or, you know, I was talking to Heidi earlier that I'm pregnant, so my husband's like, you get to stay in the house, I'll go grocery shopping. But, you know, trying to encourage him to buy us more fruits and vegetables and not the snack food. You know, when the snack food's not in the house, you can't eat it. When you buy fruits and vegetables, you know, keep them on your counter if it's appropriate, then that's the food that you're staring at. Also, you know, cut up your fruits and vegetables, the ones that go in the fridge, put them on the shelf, not in a drawer. You see those when you open the door, so, you know, you might be more likely to actually eat them than, oh, those oranges in the back, forgot about them, now they're moldy. And hopefully some of these tips and tricks will help people consume better quality food or smaller portions of, the junk food that we're tending on snacking throughout the day while we're at home all the time.
That's such good advice, because most of us aren't used to being quite as much at home as we are right now. And so it is so easy to open the fridge and to choose poorly. So if we put things to the front of the fridge that help us make better choices, we'll probably be better off overall. Thank you.
Hopefully.
Chris, some people are more serious than others when it comes to exercise and fitness. For those for whom performance is important, how do they stay physically and mentally stay sharp?
I was going to say these are challenging times. And the people training for functionality are certainly going to have to be as creative as possible. Oftentimes, you can relate that functionality to intensity training. And so, for example, without equipment, you can increase the number of repetitions of an exercise and simultaneously decrease the amount of rest between exercise sets to try to increase the intensity and the muscle fatigue that you might feel. I think that the more you can try to follow the movement patterns in your sport or activity, well, the closer you might be to functionally training. But for me, it's more about getting the intensity. They say that when sports return, the players, they're going to need a minimum of a month of training with their trainers and in the facilities just to get back on the court or on the ice, on the field. And so that would be the same for all of us. So the best you can do is try to, stay intense with your exercise and do what you can to mimic some of those movement patterns.
Thank you. That's really helpful. Now, I know that Liz is a runner. In fact, we were talking earlier that some of her favorite distances are very long, including a 50K. But Liz, how important is it for people to stay physically active? Particularly, I'm thinking right now of older adults, as we don't know how long this situation is going to last.
I think for right now, being cooped up at home or not surrounded by as many people, physical activity will help us reduce stress, manage anxiety, maybe help with depression that we're seeing on the rise during this time. I think American College of Sports Medicine always recommends at least 30 minutes a day of moderate type activities. That can be anything from gardening, trying to get your dog to walk a little faster around the neighborhood, dancing, finding activities that get your heart rate up, get your body warm and sweating. If you want to push yourself and do more vigorous activities, that's obviously a good challenge to do. 20 minutes, 3 days a week, or a combination of the both of those, and that will help, manage any mental health issues that you might be facing or any of those chronic diseases that you might have, young or old. But the bottom line is we have to move throughout the day. The more sedentary we are, we're working at home or in front of the computer, you want to break that up every hour, 1 to 5 minutes. Set an alarm if that's hard for you, if you get overly focused. Research is showing that even if we get that 30-minute session in or that 20-minute run in, if you go home and sit for 8 more hours, all of those health benefits can get negated. One last thing, if someone is using this time to start a fitness program, maybe they haven't done so in 20 years, and they have a health-related condition, check in with your doctor. Shoot them an email or call. Especially for our older, more frail participants, they're not being supervised. The YMCA programs that they went to, the community centers, they're all shut down. So
thank you both for taking time to be with us today. Obviously, we shouldn't start with a 50K. You need to work your way up to that if you're going to go into fitness. And it's important to focus on both adaptability and flexibility during these times where we may not have the equipment that we were expecting to have previously. I hope everyone has found this conversation helpful. If you have ideas for future conversations that would benefit our community, please email me at president@brockport.edu. Thank you so much.
Thank you.
Bye-bye.